So here we are, healthcare overview for HR1. So we're going to discuss today who is DVHA, the Department of Vermont Health Access. We're going to talk about the reason for engaging community partners, changes to the healthcare eligibility system and rules, outreach planning, and we'll hopefully leave some time for questions and discussion. So just to kind of give you a high-level overview for those of you who aren't familiar with our department, DVHA, otherwise known as the Department of Vermont Health Access, is one of 6 departments in Vermont's Agency of Human Services. It is the mission to provide Vermonters' health and well-being, Vermonters' health and well-being by providing access to high-quality, cost-effective care. We are, DVHA, the state administrator of Vermont's Medicaid programs. You can read more about where DVHA is and where we sit in state government and what we're all about at our website listed at the bottom of the screen. We are coming to you now as our community partners because we see community partners playing a critical role in these changes to health coverage. We think it's really important that we build awareness among partners and the Vermont community so that when members who are affected by this have questions about it, they are not talking to someone who's never heard of it before. So we realize that you are the ones on the ground supporting Vermonters, and it's our job here to begin to inform you about these changes. You'll learn about timelines and some basic overview of what's happening. On top of that, we continue to plan to share information with you over the next year or year and a half as these things evolve. We also want to get your feedback. What is landing with you and with your members, customers, and what isn't? Are there changes that we should make in the way we're communicating to make things more clear, make things more accessible, and in the end, hopefully help as many Vermonters as possible maintain health coverage. I'll pass it to Danny.
Thanks, Zach. So the changes that we are going to talk about today with HR1 are specifically changes to healthcare eligibility. HR1, or as our federal partners call it, the Working Families Tax Cut legislation, has a number of provisions to Medicaid, but this will focus on a few that are big changes for Medicaid eligibility. Next slide, please. The first one, and the first one that's going to occur in terms of timing, is a change to healthcare eligibility based on immigration status. This change will go into effect for Medicaid on October 1st of 2026, and for premium assistance, premium tax credits for qualified health plans, the change will take effect on January 1st of 2027. The population that is impacted, again, this is all of our Medicaid program, and then folks who seek a qualified health plan with premium assistance or some sort of financial subsidies. What is changing here is that going forward, after these effective dates, only U.S. citizens or nationals, lawful permanent residents, Cuban Haitian entrants, and COFA migrants will have eligible status for Medicaid and premium tax credits. This is a change to current rules and law that have been broader in terms of allowing a broader population of non-citizens to be eligible for both Medicaid and for premium tax credits. The changes here do not affect, for Medicaid at least, do not affect children under age 21. They also do not affect pregnant individuals. Folks who are lawfully present and lawfully residing continue to have eligible immigration status for Medicaid if they are under age 21 and or pregnant in the postpartum period. The second change, and then this change and the next change that we'll talk about on the next slide, the impacted population is narrower. It's Medicaid only, and it's specific to our Medicaid adult group, or what some folks refer to as the Medicaid expansion group. Currently, Medicaid has 12-month redetermination cycles. This means every 12 months we have to renew eligibility for individuals enrolled in Medicaid. For the adult group, and the adult eligibility group is folks who are age 19 to 64. They've income up to 138% of the federal poverty level. They're not entitled to or enrolled in Medicare, and not pregnant. This group will have much more frequent redeterminations. So instead of every 12 months, we'll need to be renewing their eligibility every 6 months. DVHA makes every effort to automatically renew folks. This is a process that's done so that we can kind of just check data sources that we have. And as long as everything still looks good for someone, we will renew them. They won't need to fill out any paperwork. But some percent of the population is not able to be renewed automatically and will get renewal forms. That process is just kind of doubling now from 12 to 6 months. And this is a big new requirement for Medicaid work requirements. It's still this adult group that we were talking about on the last slide. The effective date for this is January 1st of 2027. HR 1 introduces a new community engagement or work requirement for the adult group for Medicaid. This requirement says that an individual has to have a minimum income that's each month that's equal to the federal minimum wage for 80 hours of work, or they have to demonstrate that they have worked 80 hours in a month, or perform community service, or have education hours, or participate in a work program, some combination of that up to 80 hours per month, or demonstrate that they and report that they meet an exception or exclusion. There's many exceptions and exclusions provided for work requirements. Pregnant individuals, American Indians, Alaskan Natives, those who would be considered medically frail, family caregivers, parents and caretakers with children age 13 or younger, veterans with a disability rated as total, those who are incarcerated or were very recently incarcerated are excluded from the work requirement, even if they are eligible in the adult group. And just to say a little bit more on this too, when do people have to meet this requirement? When folks submit an application, they can demonstrate that they meet an exclusion in the month of application or in the month prior to application. If they don't meet an exclusion or exception at application, we would be looking to the month prior to their application to see if they've demonstrated compliance with this new work requirement. So the period at which somebody is demonstrating that they have met this new eligibility requirement is at application the month prior. And then we will be on the 6-month renewal cycles for this group. And so every 6 months, we will be looking to see if an individual in this eligibility group has either met an exclusion or met the qualifying activities, those 80 hours of work, community service, education, work programs in one of the 6-month periods between their redeterminations. Our guiding principle here is that we really want people to retain their coverage. We are striving to minimize coverage loss for Vermonters who have been eligible for Medicaid. We are looking to facilitate automatic determinations using our electronic data sources, seeking where we can bring new data sources in to help with the verifications we need to do with those automatic renewals, communications, early warnings, frequent follow-ups to beneficiaries, and I think Zach will talk more about outreach and communications in a minute. And then also looking to connect folks to resources to help them retain their coverage. An important note is that if someone is applying for Medicaid and they're not granted Medicaid due to not meeting the work requirement, they will not be able to transition over to a qualified health plan and get subsidies over there. They would be considered to not be eligible for subsidies because they didn't meet the Medicaid work requirement. I'll turn it back to you, Zach, I think.
Thanks, Danny. And just a reminder, we are going to try and leave some room for questions. If you want to start to populate them in the chat, that's probably the most effective way to generate the questions, and we'll take them, and also if we don't have time to take them all today, we will try and address them via our partner newsletter or on our website. This, if I haven't mentioned it already, or Danny didn't, just for everyone's awareness, this has come really quickly. This has been a really short and fast runway to try and get from policy to implementation. So I want to talk a little bit about what we've done and where we're at in terms of communication planning. We're currently at this developed stage. So we have really been we have dug in the trenches and tried to figure out and prepare, get ready for what we need to say and to whom. And right now we are in the middle of developing our initial content and assets that are designed to go out to customers. Not only customers, but also to partners and the public. We have a wide variety of mediums that we plan to deploy for public consumption, for partners to use, and obviously to communicate directly to customers. In the happiest path, we would wait a little bit, get more feedback before we start to deploy these things. I think given the shortened time frame, we will be looking to you and other partners for feedback as these things go live. Obviously, we are still in the development phase, so any insights or feedback or ideas you have, we can try and integrate into our development phase. This information will be communicated publicly from this summer onwards, really well into next year. So part of the design is, as we implement in the next phase, we will continue to revisit, quality check and make improvements based on the reception and feedback that we get. So we really encourage you to speak up early, often, and I will share our contact information later in the presentation so that you can give us that feedback. We want to know what you think is important about how we communicate these changes. We recognize that each one of you may have different audiences to whom we are trying to speak to. That means that some mediums that we put together may be really relevant and work really well for one audience, but not for another. We want to know that. And even if it's a small group, we want to know what would work for that small group. An example of this is translating information into different languages, or having things that are in plain language, or videos versus all written content. Those are things that we're considering, but obviously it is a very high level description of the kinds of things that we're wanting to think about. As you get more familiar with this information, you may be able to synthesize better than us, or as well as us, what people need to know. Maybe we're throwing out more information than is necessary for people to know. Maybe there is messaging that we could simplify, or maybe conversely, maybe there is information that we need to elaborate on. Please let us know. And obviously, if there are additional things that you haven't seen, if you think that a flyer that is oriented towards a certain audience would be great, and you haven't seen that, let us know. Obviously, we can't promise to do everything, but we want to collect that information. We don't want to our intention is not to put the onus on partners, but really leverage the relationship that you have with your communities, and the knowledge that you have to inform our decisions. One of the things that we have stood up is a QR code that we plan to promote much more widely. We're kind of at the beginning of this communication messaging, but we have this motto and QR code that accompanies it, which is Medicaid is changing, stay covered. The QR code links to the website that you see below, divavermont.gov, Medicaid changes. We intend to have this on a lot of our materials and encourage folks to share that QR code and that website. We will have in the coming months tools that you will be able to download from our site or share from our site that are, prevent you from needing to create anything on your own and just share with your audience. So just keep in mind that is coming. We will try our best to make it very aware, but some of the ways you can kind of stay tuned is to just keep checking back on this webpage listed here, follow us on social media, and just pay attention to when those partner newsletters come into your inbox. This is the example of the webpage. It looks a little different as of today because we are excited to share that we have launched today a screening tool. We are really hoping that this tool makes understanding the impacts of these changes a little bit more accessible, both for partners and for customers. The whole idea here is that without having to read all the details in the rules or on the website, someone can pretty quickly use this tool and determine or estimate whether or not they will be impacted. This tool, it's really important to emphasize, this tool is not a decision, and we put these disclaimers all over the tool, but just want to emphasize, this is not an eligibility tool. This is a screening tool that is meant as kind of an assistant to help educate people not to make a final determination. That will need to be made through the application or eligibility process. Danny, did you want to say something? I saw you come on.
Yeah. Thank you, folks, for those that have messaged me directly to say that the chat's not enabled for the group. Shows my ignorance of the use of Zoom. So what I've done is copied and pasted some questions I've received into the chat so that everyone can see them.
Sorry about that, folks. Yes. We will see if we can enable it. Let me just say, feel free to take a screenshot of this now. It should be live. Pull it up on your phone, go to that website, and you should be able to check out that tool for yourself. What's coming? I referenced some of this, but over the next several months, you will begin to see more updates to that website. That is a website that will continually evolve as more information is clarified and it gets closer to the date where folks have to take action or may have to take action. We will be promoting information on our social media, often linking back to the screening tool or the website, but that is another way to raise awareness. We are planning both digital and print informational toolkits that I referenced before. If there are particular pieces, examples of like a material that you think would really be helpful in that toolkit, please reach out to us. An example is I was just in a meeting before this, and someone recommended a sticker with the QR code and motto. Not something that was necessarily on our docket, but I love the idea. So, any kind of suggestions are welcome. There will be a paid media press on this when it gets closer to the important dates and deadlines for folks. And obviously, as usual, customers can expect direct communication from us through paper mail, also through email and text. So one final slide on how you can help, and then I think we'll open it up for some questions. Um, we really are looking to you to leverage your community knowledge. We want you to contact us with specific feedback about ideas how we can best and most effectively communicate with Vermonters. I think I said that in another way. Really, bookmark this webpage, that webpage. Again, the QR code is there again. That is going to be your hub for information. And then share this information, share the website, share the toolkits, promote the information in our newsletters, give us feedback. The QR code on the top of the screen should bring you to the Vermont Health Connect, which is our team's email address, where you can provide any feedback. And also for general questions is a place to go. It's not a place to ask specific case questions. Or provide any kind of confidential information, but you can certainly ask general questions there, and we can try and get you